Obsessive-compulsive personality disorder, often abbreviated as OCPD, represents a complex psychological condition characterized by a pervasive preoccupation with orderliness, perfectionism, and control. Unlike its similarly named counterpart, obsessive-compulsive disorder, OCD, which centers on unwanted thoughts and ritualistic behaviors, OCPD manifests as a deeply ingrained pattern of thinking and behaving that the individual typically perceives as normal and even desirable. This fundamental distinction highlights why OCPD often goes unrecognized for years, as those affected frequently view their meticulous attention to detail and rigid adherence to rules as virtues rather than symptoms of a condition requiring intervention. Epidemiological studies suggest OCPD affects approximately 2 to 8% of the general population, making it one of the more prevalent personality disorders encountered in clinical settings. The cognitive landscape of individuals with OCPD is dominated by an unwavering commitment to perfectionism that extends far beyond healthy striving for excellence. This perfectionism manifests as an unyielding insistence on flawlessness in virtually every endeavor, accompanied by an excessive attention to minutiae that others might reasonably overlook. Individuals with OCPD often establish impossibly high standards for themselves and others, experiencing significant distress when these exacting expectations inevitably go unmet. Their thinking tends to be remarkably black and white, with little tolerance for ambiguity or middle ground solutions. This rigid cognitive style frequently leads to a persistent sense of falling short despite objectively successful outcomes, as no achievement quite matches their idealized vision of how things should be. The relentless internal critic that accompanies OCPD rarely allows for satisfaction or a sense of completion. The relationship with work represents perhaps the most visible manifestation of OCPD. Affected individuals typically demonstrate an extraordinary devotion to productivity, often at the expense of leisure activities and relationships. They may immerse themselves in projects with remarkable dedication, displaying a level of conscientiousness that initially earns praise from supervisors but eventually creates bottlenecks as they struggle to delegate or complete tasks that fail to meet their exacting standards. The concept of work-life balance holds little meaning for those with severe OCPD, as they frequently view relaxation as wasteful or self-indulgent. This devotion to productivity stems not primarily from ambition or career aspirations, but from a deeper belief that industriousness represents a moral virtue. The individual with OCPD doesn't merely work hard to achieve goals. They work hard because they believe anything less reflects a character deficiency. The organizational tendencies associated with OCPD extend well beyond basic orderliness into elaborate systems that demand precise adherence. Affected individuals typically create complex rules and procedures for even routine activities, experiencing significant distress when these systems face disruption. Their living and working spaces often reflect this organizational preoccupation, with items meticulously arranged according to seemingly arbitrary but internally consistent principles. This isn't merely a preference for neatness, but rather reflects a fundamental need for control over the environment. The individual may spend excessive time organizing possessions or information, creating elaborate classification systems that others find unnecessarily complicated. While this organizational tendency can prove beneficial in certain professions requiring attention to detail, it often becomes problematic when the process of organizing takes precedence over the actual completion of tasks or when flexibility becomes necessary. Financial management reveals another characteristic dimension of OCPD, a marked tendency toward frugality that extends beyond reasonable financial prudence. Individuals with OCPD typically approach money with extraordinary caution, often hoarding resources even when objectively secure. They may resist disposing of worn-out or useless objects, just in case they might serve some purpose in the distant future. This reluctance to spend applies not only to themselves, but extends to organizational resources as well, sometimes manifesting as miserliness that creates friction in family or work environments. The underlying psychological dynamic involves not simply financial conservatism, but a deeper sense that extravagance represents moral failure. This frugality frequently coexists paradoxically with a willingness to invest substantial resources in work-related pursuits aligned with their perfectionist standards. The interpersonal relationships of those with OCPD present particular challenges, as their rigidity and exacting standards inevitably impact social connections. Romantic partners often describe feeling constrained by inflexible routines and expectations, while friendships may suffer from the OCPD individual's difficulty compromising or engaging in spontaneous activities. The tendency to view issues in moralistic terms rather than pragmatic ones can lead to frequent judgment of others who fail to adhere to their strict principles. Notably, individuals with OCPD often struggle to delegate tasks, believing no one else will complete them properly, which creates significant tension in collaborative environments. Their hypercritical approach to others' performance, coupled with difficulty expressing warmth or tenderness, can leave loved ones feeling perpetually inadequate despite their best efforts to meet expectations. The developmental origins of OCPD likely involve complex interactions between genetic predispositions and environmental influences. Research suggests that temperamental traits such as harm avoidance and persistence may have heritable components that create vulnerability to the disorder. Environmental factors, particularly childhood experiences emphasizing strict performance standards, moral rigidity, or punishment for mistakes, appear equally significant. Children raised in households where love or approval seemed contingent on perfect behavior may develop OCPD traits as adaptive responses that persist into adulthood. Some developmental theories suggest that OCPD emerges as a strategy for managing anxiety about potential chaos or failure, the rigid systems and perfectionism serving as psychological defenses against deeper feelings of uncertainty or inadequacy. Diagnosis of OCPD requires careful clinical assessment by qualified mental health professionals. According to contemporary diagnostic frameworks, OCPD manifests as a pervasive pattern of preoccupation with orderliness, perfectionism, and control, beginning by early adulthood and present across various contexts. Diagnostic criteria include at least 4 of the following: preoccupation with details and rules, perfectionism that interferes with task completion, excessive devotion to work at the expense of leisure, inflexible morality and ethics, inability to discard worn or worthless objects, reluctance to delegate, miserliness towards self and others, and rigidity/stubbornness. These symptoms must cause significant impairment and represent a persistent pattern rather than responses to specific situations. Differential diagnosis is particularly important as symptoms may overlap with obsessive-compulsive disorder, anxiety disorders, or other personality disorders. The treatment landscape for OCPD has evolved considerably in recent decades, though intervention typically proves challenging due to affected individuals' limited insight into their condition and resistance to change. Cognitive behavioral therapy approaches focus on identifying and modifying perfectionistic thought patterns, gradually introducing flexibility into rigid belief systems, and developing more balanced approaches to standards and expectations. Schema therapy has shown promise by addressing early maladaptive schemas that maintain personality disorder symptoms. Psychodynamic approaches may help individuals understand unconscious motivations behind perfectionism and control, potentially addressing the core insecurities driving these behaviors. While no medications specifically treat OCPD, pharmacological interventions may help manage co-occurring conditions like anxiety or depression that frequently accompany the disorder. Group therapy presents unique benefits for those with OCPD, providing structured opportunities to receive authentic feedback about interpersonal behaviors in a supportive environment. The group setting challenges the black and white thinking common in OCPD by exposing individuals to diverse perspectives and problem-solving approaches. Skills-focused groups targeting specific behavioral patterns such as perfectionism, delegation difficulties, or rigid thinking can be particularly helpful. Through these approaches, individuals can gradually develop more flexible cognitive patterns and interpersonal behaviors, recognizing that imperfection rarely leads to the catastrophic outcomes they anticipate. The group context also provides opportunities to practice compromise and collaboration, skills often underdeveloped in those with OCPD. The workplace implications of OCPD deserve special consideration, as professional environments often amplify both the strengths and challenges associated with this condition. On one hand, individuals with OCPD typically demonstrate exceptional reliability, attention to detail, and commitment to quality that make them valuable in roles requiring precision and thoroughness. On the other hand, their perfectionism may create workflow bottlenecks, while their difficulty delegating and compromising can undermine team dynamics. Career counseling can help identify vocations that constructively channel their natural meticulousness while providing support for developing more collaborative approaches. Workplace accommodations might include clear written expectations, structured feedback processes, and gradual exposure to delegation through carefully selected tasks with defined parameters. Living with or supporting someone with OCPD requires particular strategies and understanding. Family members often benefit from education about the disorder to recognize that rigid behaviors stem from psychological needs rather than intentional inflexibility or criticism. Setting boundaries while acknowledging the OCPD individual's need for structure represents a delicate but essential balance. Partners and family members can encourage flexibility through gentle exposure to alternative approaches rather than direct confrontation about rules or systems. Support groups for family members provide valuable perspective and coping strategies for the unique challenges of these relationships, particularly in navigating the criticism and control that often characterize OCPD interactions. The cultural context surrounding OCPD merits consideration in any comprehensive discussion, as many societies highly value the very traits that define this disorder. In achievement-oriented cultures that emphasize productivity, precision, and self-discipline, OCPD traits may be not only tolerated but actively rewarded in educational and professional settings. This cultural reinforcement can delay recognition of the disorder and complicate treatment, as individuals receive external validation for behaviors causing internal distress and interpersonal difficulties. Additionally, cultural variations in concepts of time, efficiency, and perfectionism significantly influence what behaviors are considered pathological versus adaptive. This contextual awareness helps ensure fair and accurate understanding of the condition beyond simplistic labels about being perfectionistic or controlling. Recent research has shifted toward dimensional rather than categorical approaches to personality disorders, suggesting that OCPD traits exist on continua rather than as discrete conditions. This perspective recognizes that many people may have some obsessive-compulsive personality traits that serve them well in specific contexts without causing the pervasive distress and impairment that define the disorder. This nuanced view promises more personalized treatment approaches tailored to each individual's specific pattern of traits and challenges. As understanding evolves, integration of neurobiological research with psychological perspectives offers hope for increasingly effective interventions for those affected by this complex condition, potentially helping them maintain their admirable attention to quality while developing greater flexibility and balance in their approach to life.